introduction video, you know that I have headaches and they're bad enough that I'm home now. So this is what I look like. I do apologize also for not doing a video earlier because of the headaches. I'm kind of restricted. I can only do things when I'm feeling well. And although I'm not pay-free, I'm well enough to do this right now. So I'm going to talk about treatments that I've used over the years, medical advice that I've gotten, and just different treatment options. I'm going to start with migraine medications. These are specific types of medications, and they're not just an anti-inflammatory or a pain reliever. So when I had my first migraine attack, I didn't use anything, and when I had my second migraine attack, I had the aura where I was losing or getting blurry vision in one eye, and there was no pain when I had the blurry vision. But as soon as that blur, it started with a dot, and as soon as it took over my whole eye, that's when the pain hit me. So for that migraine attack, I was given Maxalt. Now after that migraine attack, I was having a migraine attack every month during my period time, which isn't very uncommon because of your hormone levels fluctuating so severely. It triggers migraines. So this was the best chance to, I guess, experiment and see which migraine medication would work best for me. Then I tried Zomig, I tried Imitrex, I tried a couple more in between. I can't remember what they are. But I was finally given a sample. So that's where I am with my migraine medications. Now I want to talk about painkillers. I have had headaches for over 10 years now. I used to use just Advil or Tylenol, things you get non-prescription medications. And then when the headaches started getting really bad, where I was having a migraine attack every week, so I was calling in sick to work every week. This was probably about 6 years ago. After about 4 months, I went to the doctor. I said, something is not right. I have a migraine attack every week, but I still have a headache every single day. And I am aware that a migraine can last anywhere from a day to a week. And I've had those also. So my doctor thought maybe I had a sinus infection because I was complaining that my face also hurts when I have a really bad migraine or headache. So he put me on antibiotics for about 6 months. After that, was still, there was no relief. He sent me to your neurologist. This neurologist, and in the meantime, he gave me Toradol to help cope with the pain. Toradol was working well. I would say about 6 years ago, on a scale of 1 to 10, my headaches were 8 to 10. Now, they're about 15 to 20. Or anywhere from 10 to 20. Today, I'd say it's probably a 5, so it's not bad. Yesterday was maybe an 11. Sorry, excuse me. So just to give you an idea on the pain scale. So the Toradol was helping. If it was a 10, I'd come down to about a 7. As the years went by, my pain level was at 15 to 20. It would come down to maybe a 10. Still not functionable. So I went to the neurologist, and he started herbal supplements. He started natural therapy, which worked great for me because I don't want to be on painkillers. I don't want to become reliant on them. They helped, but they didn't help a great deal. So my pain went from a 10 to a 7 every day. The Toradol, I helped bring it down a little bit. Now, Toradol I would use maybe once a month with my migraine attacks. So you pop an Axert and you take a Toradol, and I can ride it out because I'm asleep. So I was always afraid to try acupuncture, even though I had heard that they help with headaches. But at this point, I thought I'm in so much pain. What's a little needle gonna do to me? So I went to him and we started changing up my diet. We started looking at different herbal supplements, different vitamins, just natural therapy. Again, so I've done everything from zinc to magnesium to trying to control naturally my hormone spikes. I've tried B12 and a whole bunch of other stuff. This is with the diet change, trying to figure out what's happening, if I'm allergic to anything or what's going on in my body. Diet change didn't help. Some of those herbal supplements did help. But once again, not to the extent where I was no longer calling in sick. So what I did was I went back to my family physician, having done a little bit of research on neurologists in the area. And I said, can you please do something about this? She said to me that because I have a history of headaches, there's nothing she can do, and she will not give me painkillers. At this point, this was 2.5 years ago. My pain level had risen from 10 to 15. It was between 10 and 20 at this point. Luckily, I had another job and my employer was awesome. He understood that I have headaches, and even if I look well, I'm not well. So my doctor wouldn't give me painkillers. And I said, well, okay, I have some names of neurologists. I'd like for you to give me referrals. So that's what she did. That was the last time I went to her. In the meantime, I've seen a neurologist who has given me 2 options. I believe it's an anti-seizure medication, Topamax. I can't remember right now. Yeah, I can't remember right now. Or Botox. Botox, I've heard that it works because it freezes everything. The problem with that is I'm not working anymore. That's $500 a shot every 3 months. I also understand there's a possibility that if it does work, I'm able to go back to work. But if it doesn't, that's a waste of $500. So that's something I'll get to that actually. So I left there. She wanted to try me on Topamax first. But she also said that Topamax, there's a great chance I'm going to get sick off of it. And that just scared the living heck out of me. I'm already feeling so horrible. Do I really want to take the Topamax and make myself sicker? And it's going to take about 2 to 3 months to feel any effect. And she did say most of the time, for the 2 to 3 months, you're going to feel sick. What do? I have it with me. I haven't thought either way yet. So it's just sitting in my drawer. In the meantime, I found another doctor. Somebody who does trigger injections. I've heard these work. So I started seeing her, and once again, like every doctor I see, they say, oh yes, we have patients who have headaches, and we've done this, or this, and they're better. I've heard this a lot in the last couple of years, so I also have realized that my case is not an ordinary case. So I started seeing her and getting lidocaine shots. It's been almost a year. There's been a little bit of an improvement, but when I started seeing her, I already knew the time was coming for me to stop working. I was working when I started seeing her. That was the hardest thing, to come to her and say, I think it's time for me to stop. I cannot do this anymore. So these lidocaine shots I get them weekly. They help for about a day, and that's about it. So recently, we had another review of these lidocaine shots with the doctor. We sat down, we talked about how well it's going and how it's not going. And we decided it's not doing what it should have been doing for me that it has done for other people. So now what she's doing is, because of these headaches and because of the years that I've had them, because of the intensity of my headache. My back has gone crazy from about here to my pelvis area. My muscles are just gone wild. They are clenched up so tight, and they have been for so many years that I don't even know what it feels like to have a loose body. So that's what she's doing now, is just trying to keep my muscles in order, and I have to do this every week because with the headaches that I get every week, by the time I get to her, my muscles are gone back to a stiffness that bothers me. Now, we have also discussed Topamax and Botox. What she wants to do first is Botox. So I've discussed that with her, and she thinks that's the route we should take, but we can't do it right away because I have a few things coming up in the next couple of months that I won't be in the country. So in the meantime, she has given me a prescription of Tylenol 3. And now, for those of you who have migraines, you know you're nauseous quite a bit. I'm nauseous almost every day, and I swear by these. These are C-bands. They're just drug-free nausea bands. I don't believe I have one with me right now to show you, but it's just acupressure, and you put them on and they work wonderfully. I wear them all day long when I have severe nausea, and for nighttime she's given me Gravel 50 milligrams. You take one tablet. If I have a headache I can't sleep, if I'm nauseous I can't sleep. So I take one of these and I'm asleep for 10 hours. It's great. Even if the headache's not going away, at least I'm able to get some rest. And the Tylenol 3, I had it filled about 4 months ago, and I've only used 3 tablets so far. I don't abuse my medications. I always have a fear of being addicted, and that's just a personal fear of mine, so I just try to stay away. I'd rather not pop the pill when I feel a little twinge of a headache. Some people are okay with that. Some people think that's absolutely ridiculous. You know, if you have a little bit of pain, you should take the medication. And the other thing I keep is the Tylenol 1s. Tylenol 1 is over the counter. If you go to the pharmacy, you ask your pharmacist for acetaminophen with codeine. Yesterday was Super Bowl. I'm a huge NFL fan. And it was 2:30 and I'm in bed with migraine or a headache, and I was just bummed. I cannot believe I'm missing the Super Bowl for this. I'm not going to take a Tylenol 3. I'm not going to go to that extent. But I took 2 Tylenol 2s, which hold the headache. They hold the headache back a little bit. I still have a headache, but I'm okay to be in an environment where there's a little bit of noise. So that's what I did. It's sad, I know, but I couldn't miss the Super Bowl. Other than that, so I've seen a naturopathic doctor, I've done acupuncture, I have to go back to my chiropractor. And the other thing that was mentioned to me was pain management clinic. I didn't know these existed until a couple of days ago. I don't know how they work. If anybody out there has a little bit of information, I will be doing my own research. But that's my next step, is thinking about